We've got amazing smelling lunch for taking the time to join today. I really appreciate you guys, and thank you for supporting us. Get here today. I was in the lot. Thank you. So I'm Heather Martinez. Who am I? I'm just a local oncology nurse. So I'm a local oncology nurse. I've been working in the local community for over 20 years. I have been treating patients bedside and ended up stepping away to work in the navigation world. So does anybody know what a nurse navigator is by chance? Good. I hope you know what a nurse navigator is. So I actually work with the Sarah Cannon Cancer Network, which is the cancer network of all HCA hospitals. Does anybody know who Minnie Pearl is? So her real name is Sarah Cannon. Oh. So she was a comedian and a song actress at the Grand Ole Opry for 40 years. She had breast cancer. In the late 1990s, she lent her name to our main hospital in HCA in Nashville and gave her name to this program. She believed that everybody should have a navigator to walk with them through their cancer journey. So that is what I do. So my family has a very strong history of cancer. That is why I became an oncology nurse myself. I was always so interested. How do you get cancer? Why do you get cancer? How do you prevent it? I was always so curious from a young age. Today we're talking about colon cancer. My grandmother had colon cancer at a young age, so it's always very interesting to see that. So when I talk about the GPS for a cancer patient, if you have a cancer diagnosis, you suddenly go from having a PCP to having a medical oncologist, a surgeon, a surgical doctor, you have a radiation oncologist, you have all of these doctors. You don't know what to do with all of them. You don't know how to show up to all of them. So our navigators are there to hold your hand from beginning to end. So that's what we do. HCA hospitals here in Utah, you may know them as the Mountain Star Hospital. St. Mark, Logan, they are part of the HCA family, though it's just not branded that way here in Utah. So what are your risk factors? What are they? So non-modifiable, something you cannot change. If you're over the age of 50, you have an increased risk of getting a colon cancer. Family history. For family history, we really like to look at the age of the family member. Were they 50 or younger? Was it a close family member? Was it a sister? Was it a brother? Sibling? Was it a mom or dad? That plays a huge role in your risk of getting cancer. Now, if it was your great aunt or your uncle, they were in their 70s or 80s when they got diagnosed, it's a little different. The risk for you would be lower. It really points out if they're under the age of 50 and the closer relation you have to that family member, the higher chance of getting a cancer yourself would be. Ethnicity does play a role in this. We do see through clinical trials that some ethnicities have a higher risk of getting a cancer diagnosis. What can we change? I love that we can stop smoking. We all know smoking, back in 1950s, your doctors were smoking in the doctor's office. They were smoking right there with you. We now know that leads to a cancer diagnosis. We know that smoking's not good for you. And it doesn't just increase your risk of maybe colon cancer. It is head and neck cancer. It's lung cancer. Being overweight, staying within a healthy weight. I'm so grateful to read about some healthy foods today because that is so important. Really watching what we eat. Type 2 diabetes. Type 2 diabetes can be modifiable in most cases. In some cases, our bodies just don't like to do what we want them to do, and we can develop them. So being screened for those as well is super important. Oh, this is a big one. I like to smoke my meats. I like processed meats. I know they're not good for me. That gives you an increased risk of colon cancer. Limiting your red meat to twice a week can really help your body decrease that risk. Low vitamin D. This is a huge one. We live in Utah. It's cloudy a lot of the year. We might not go outside unless you're a skier. Is anybody in here a skier? I see the head like, yes, you're going out and getting that vitamin D. I hope you're wearing your sunscreen. You're closer to the ozone layer. In Utah, our #1 is skin cancer, and I heard Tree mention that you guys have a talk on skin cancer coming up. In Utah, our #1 cancer is skin cancer because we are so high in elevation. Gotta wear that sunscreen. Having low vitamin D can increase the risk of many cancers, so taking a supplement is huge. Getting that checked with your provider just to see where that's at. And alcohol. really, if you look at the Attorney General says no alcohol is good enough. To drink alcohol, limit it to 2 drinks for men a day and 1 for women. I think in Utah we see that limiting a little bit with religious beliefs here. But if you're gonna take alcohol, you're gonna drink it, have a good time, but limit that alcohol. What are other risk factors? Like we talked about, personal family history. If you have a family member that goes in to get a colon cancer screening and they find polyps, or there are a numerous amount of them, that really plays a role. If it's 1 or 2, you might not have to worry about it. But if they're seeing a lot of polyps, you need to check and see, is this a family thing? Are we just people that create polyps? Certain humans just create things in their bodies. That's what we do. We're all different. So that is a key thing to keep a close eye on. If you have family members saying I have polyps removed, think, okay, I need to make sure I get that right screening for me to make sure. Inflammatory bowel. A lot of us, we all talk about, tummy troubles. We can have that. GI adventures are no fun. When we have something going on with our GI tract, super important to stay close to your primary care doctor and say, what point do I have to go in and have a colonoscopy? Hopefully everybody's okay with me talking about colonoscopies during your evening. Awesome. And I promise I won't show any gory pictures. So 5% of the population has an inherited gene mutation called Lynch syndrome. Lynch syndrome will lead you to have multiple cancers in your lifetime. It is not common. It is really rare that you see that. If you look at cancer in general, only 5 to 10% of the time will it be inherited. It will not have a family gene. It's very rare to actually see that. Colon cancer and cancers in general. So this, I don't know, I never say this word. I'm a nurse and I can pronounce the hardest chemotherapy names, but yes, that last word there is so hard for me to say. And every GI doctor laughs when I go into their office. I'm like, that word is difficult. So I can move it. But 1% of that time will be a family diagnosis. Signs and symptoms. What are we watching for? Our bodies can change on a daily basis. So do you know your body well? Do you know what your bowel habits are? It's really, really good to know your body best. Because for me, I could have 1 a day. You're all good. But for the people in the front row here, cool. I go every other day. That's great. When you go in for your yearly physical, hope you all are with your primary care, say, this is what's normal for me. I'm starting to notice a change. I'm having increased bowels. They don't seem normal. Your doctor's going to say, okay, let's say, did your diet change? Did your lifestyle change? Stress could cause a lot of that. Be standing up here, whoa, it's terrifying. I can run out of the room terrified with that. But know your body fast. What's normal? If you have a change, call your doctor. It could either look like increased frequency of stool or constipation. You're going 3 or 4 days. Normal. Go to your doctor and say, this feels different. Any type of rectal bleeding. Different things could cause that, but really a big sign. If you're noticing any blood. And I know people say, I don't want to turn around and look at it. Know your body best. Know what's coming at your body. So just check it out. Abdominal cramping. This isn't like, oh, maybe I ate that real spicy food and I've got a tummy cramp. This is like cramping that you really can't pinpoint to something. Oh, my stomach hurts at the most random parts of the day. Maybe I haven't eaten today and my stomach hurts. Okay, let's get that checked out. Why is there something on in my gut I don't know about? Loss of energy, weakness, and fatigue. Who in here has fatigue? Oh, we all do. We're all humans. We all have a crazy schedules, busy lives, and I think with social media and different work schedules, we tend to run ourselves a little bit right. But know yourself. Fatigue is really going to show up once you take that nap. You should wake up and go, oh, better. But if you notice you're waking up every day and go, don't have the energy to keep going today. This feels different. This is dragging on for days at a time. And you go to your doctor, they're going to start to do diagnostic workup and say, why are you so tired? Would you have a little bit of blood loss? Could you have a little anemia? Okay, let's see. Let's check that out. What's your age? What's your family risk? Do we need to do a colonoscopy to make sure there's nothing going on? And unintentional weight loss. That's a big one that I've seen. being an oncology nurse, we'll have patients come in and they're like, I lost 70 pounds in the last 6 months. And I'm like, oh my gosh, what did you do to lose 70 pounds? That's amazing. I want to know the secret. It's a good secret to have. I mean, some of these patients are losing 5, 10 pounds a week. The human body is designed to lose maybe 2 pounds a week on average. So if you suddenly are losing all this weight, good, but why? Is there something in your gut stopping your body from getting all the nutrients it needs? There's something going on in there. I'm all about questions or anything. So if you guys have any questions as we're going through or want to stop me, just raise your hand. You can answer questions. So when should you get screened? Feeling right now they're saying average is 45. At 45, get that first screening. Seems pretty young. They lowered it from the age of 50 within the last 5 years, which is super important. We are seeing out in the community people being diagnosed with colon cancer at a younger and younger age. There's nothing that's really been pinpointed to say, oh, this is a problem. Could it be our diet? Our Western diet is so processed. So it could lead into that. I want to know what could be causing that. So 45, think about getting screened. That's super important. Which is pretty cool. If you go to 45, you have nothing going on, you can wait a whole good 10 years before you have to go back again. That's awesome. I mean, if you think about life expectancy at 45, I'm healthy, I don't have to go back in for another 10 years. You may only have a handful of colonoscopies your whole entire lifetime. It's pretty cool when you think of it that way. But if you start having issues, you know, you're noticing, oh, I'm losing weight, or I'm tired, or my gut just seems really off, you can always call your primary care doctor and say, you know, I had a colonoscopy 5 years ago. I'm really concerned something feels different. Do we need to repeat it, or can they do other interventions? Always be open. Talk you need to have with your primary care doctors. If you don't have your primary care doctor, get with your insurance and find one. It's super important to have one. They probably say 85 and older, you don't need to have a regular screening. As you get older, your gut changes. There can be risks for the older patient prepping for a colonoscopy. They could get too dehydrated. That happens. They just fell. Their just GI makeup in general could not tolerate it or break that balance. So the older you are, if you have older parents or grandparents you're taking care of, you know, just assess that. What can they do to look at that without? When should you get screened? We all know 45. Make that appointment to get screened. Like we talked about, the family member, you have a sibling that had colon cancer. Okay. What age were they when they had that cancer? We all talked about under the age of 50. Go get screened. If you've had polyps, they may want you to come back in every 3 years, which is normal. Polyps take a long time to grow. If you really look at polyps growing, they take a very long time. And I believe I have a slide on that, but 10 to 15 years for a polyp to grow. That's a long time. So every 3 years, if you've had a polyp, that's really reasonable too. That's not one day. One day out of your year, every 3 years, it's not bad. Patients who have other diagnostics of cancer, if they have a lung cancer, they may do higher screening because cancer can metastasize. So you may see if you have a different diagnosis, you may get screened more often because your body, your immune system has already let that naughty cancer cell grow, so you may have to go more often. What are your options? There are a lot of options. I think it's pretty cool now that it's not just the colonoscopy or this. Words. I'm the worst nurse for pronouncing it. Your colonoscopy, that's really your gold standard if you think about it. A doctor's going in there, they're taking pictures, they're visually checking the GI system, what's in there, what's going on. It's a great way to look at it. But not everybody can miss a day of work. Not everybody has a driver. If you really look at that barrier to getting someone in for a colonoscopy, these things happen. Really, if you think about someone that, you know, if I jumped on a plane and decided to move to North Carolina today, I would not know one person to take me in my colonoscopy. There's no service out there. Maybe this is, you know, a business plan for someone to drive people to their appointments. You have to have someone there with them. So you kind of think about that. The limitations on the prep. I know everybody's pressed with cancer, but that colonoscopy. They're getting better with those, really. A lot of them you can do at home with Gatorade and a little bit of stool softener now, which is pretty stinking cool. You don't have to drink the big jug of disgusting that you used to, which is pretty nice. I see the groans in the room. I'm like, I'm gonna do a prep for this. It's pretty disgusting. The nice thing about a colonoscopy is, like I said, visual look. If that doctor is in there and says, "Ooh, I see something in there," they can remove it right away. We have some other tests that came onto the market in the last few years. This fecal immunohistochemical test, FIT testing. That is a stool sample that you would send in. You may hear the word Cologuard, I believe, around that. That's one that I've seen commercials for. And some insurances are actually sending those out to your house. It's what you hit, 45 or 50. Some insurance companies are saying, hey, get this done. You can catch cancer early. It's manageable, it's treatable, it's cured. The longer you wait, the later stage you are, manageable, but it might not be cured. So the sooner you can check this out, the better. The nice thing about these FIT tests at home, there's no prep. No prep at all. You may just have to send in a sample through the mail, which is highly amazing. It cuts down on, you don't have to take a day off work. You don't have to have someone to drive you. Whatever your life looks like, if you do have a positive with those, they do make you go in and have a colonoscopy. So a lot of times they are seeing with these FIT tests, there's a higher positive rate with these that you may have to go in and have more diagnostics just to be on the safe side. This test is still new enough that they're still developing the kinks out of it, but it's a great option if you just don't have the time. Has anybody tested that? I got a great family history. You know what? It was great. I was doing a lot of traveling work. I thought, I am my own worst critic right now, but I don't know how to take this test. I want to go to hospital. I want to act. You know? But it was a great option for where I was at in life. Keep that great. Whatever test you choose, it's up to you. Just get screened. It doesn't matter. It's whatever works best for you. You have the time to go get the colonoscopy, go get it done. It's easier just to send it through the mail. Send it through the mail. So looking at prevention, really, like I was saying, the polyps, 5 to 10 years to develop. They grow extremely slowly, and there's really no signs or symptoms that you know one is growing. You may get a twinge of pain, or that could just be the spicy burrito you had to talk about. You don't know. Never know. So, like we said, maintaining a healthy weight. I'm excited. I was hearing Trudy talk about your steps program. I love that. What a great way to stay within a healthy weight, getting those steps every single day. And if there's any incentives through your work to get those steps, by all means use that. So just increasing your physical activity in general. The Surgeon General is saying that sitting is the new smoking now. Look at our lives. A lot of our jobs are sitting. I mean, as a nurse, I do work in the corporate world now. I sit for 8 hours a day, where I used to be up and running for 12 hours. Definitely gain some weight as you're sitting there. So really, once an hour, get up, take a walk, get your body moving. I was reading a study on what's the best kind of physical activity to like get my heart rate going. 10 squats an hour is equivalent to walking for an hour. I was like, are you joking? That's not real. Very real. So if you can get up by your desk, you may look a little. Do a few squats by your desk. Get those knees low. I don't know how your knees are, but get the squats. Increasing your fruits and vegetables, really getting that increased fiber intake. Our little GI system, our little gut, it really wants those natural foods in there. It wants that apple with that peel on it. It wants that kiwi with the peel on it. Those are all natural fibers that you can get out in the current environment, which is amazing. Whole grains are great. I don't know if you're gluten or not, or do the gluten-free stuff. You can still get enough fiber in those as well. But I didn't put anything about vaping on here. There are no correlations between vaping and colon cancer. Those studies have not come out yet, since vaping is so new, but smoking does have a correlation to all the chemicals that go into our body with colon cancer. And these are my records. I went through everything super, super fast. to the point, I'm very passionate about getting your colon cancer screenings, any screening in general. I know we're in October and it's breast cancer awareness month, and you're going to see pink washing everywhere. There's pink everywhere you go. But just remember, it doesn't matter what month it is. Cancer screenings are super important to get. Open it up to everybody. Any questions? Anything to chat about what the screenings look like? Yeah.
Just saw a lot playing on really reliable source TikTok about like how we're not getting enough fiber in our diets. That's what, especially colon cancer. There's any validity in that.
There is some, yes, because a lot of our processed foods, if you look at them, don't have enough fiber. Us as humans, I didn't see it on TikTok. I read a lot of studies about very nerdy, like all this stuff. But on an average, I believe they said any human in a given day is missing about 30% of their fiber. And you have to have a lot of fiber. So think about supplementing. I know you may see the Metamucil commercials and you're like, oh, that's something my grandparents used to drink for breakfast. But honestly, there's so many great supplements for fiber out there. They have fiber gummies now, and they really do increase your fiber intake. It definitely helps. That's such a great thing to mention. Any other questions? Yes.
I know that you said that obviously the prevalence is on the rise. Has there been a difference in that rise for men versus women?
You know what? They are seeing it increasing in men more than women. They haven't put out great studies on it, but they do see a higher prevalence in men. And it might just be linked to the diet. It could be linked to the later age that men tend to get screened at. Men tend to wait because they tend to have longer working hours, or their wives didn't make them that appointment. Because I know my husband, if I didn't make him an appointment to go somewhere, it's not going to happen. And I see people laughing in here, but it's true. Men typically don't make their appointments. Women tend to write those. So I encourage us to get those screenings done. Yeah.
If you, excuse me, if you had colon cancer, what is the normal treatment for it? Is it like a chemo or is it?
That's wonderful. So it all depends on the stage you're diagnosed with. So if you didn't hear a question, it was, what's the typical, sort of, what would you say, sort of pathway through a cancer diagnosis? So if it's an early stage, 1 or 2, it is going to be surgery up front. Anytime there's a cancer diagnosis, if we can remove it with surgery, that's going to be number 1. Can we cut it out and get rid of it? Number 2 would be radiation. It may go along with the surgery to radiate the tissue around that area to kill any microscopic cancer. It takes 500 million cancer cells to actually be seen on a PET scan or a CT scan. Oh. Microscopic cancer can hide in some of those areas. So compatibility with a surgery and a radiation to that area that was affected, great treatment, and you have a higher likelihood of cancer not returning. They really wouldn't, at stage 1 or 2, they really wouldn't push you into a chemotherapy. So chemotherapy is really to systemically treat us head to toe, because we don't know where those cancer cells are hiding. When you start to see maybe a stage 3, or that would mean that a cancer is growing outside of the original spot, it's trying to migrate or metastasize, is when you would say, maybe we need to look at giving a chemotherapy up front to shrink it before any surgery or radiation. So as you can stay ahead of your colon cancer screenings and do your screenings early and as often as you might need them, you could prevent catching that cancer at a later stage. But here in Utah, about 40% of cancers are found at a stage 3. We don't do a great job in the state of Utah of catching cancer. Yeah. No,
For those tests that you get on the mail, it's a good test. What I mean is accurate.
Yes. So the question is those tests you send in the mail, are they accurate? They are accurate. They do have a slight likelihood of seeing more positives because they're testing for white blood cells that are coming out in that sample that's going in. So we see a little bit higher positivity rate. That high positivity rate does bring the patient into having a look. So when that patient says, okay, like this is down for me, I have time, I can go back and get a look at. Sometimes it doesn't turn into anything. So it is a great test. They are extremely reliable, and I see a lot of insurances turning to that route.
Thank you. We talked about stage three concern being that it's growing outside of the original area, but what's the difference between stage one and stage two?
Yeah, so it's the sizing of it. When we look at a stage 1 cancer, it's really the size and the spot in the body that it is. Is it in the colon? Is it in the rectum? Is it higher up in our intestinal tract? And it really depends sort of where it is and the size. If you can find that cancer when it's small enough, you can remove. Once you start to move to a stage 3, I believe you're seeing it, and going off my memory, it's closer to a 6 centimeter, 7 centimeters, so it's quite larger. If you can go in and get those colonoscopies and they see a very tiny polyp that's, 1 centimeter, they can pop that out, no problem. At stage 2, we see them to be a little bit bigger, but still easily removed. And if you're not looking at, oh my gosh, you worry about maybe having a pouch or a bag or something like that. Really unlikely. We have some great surgical options now to where they can just remove that site, get you healed up, straight to normal life.
I have one more.
Yeah.
The polyps that they remove when you have your colonoscopy, what percentage of those are cancerous? Because I think people often have polyps. but don't-
Extremely low. There's probably less than 20% of those come back to actual cancer. It's very low.
Why do Native Americans in Alaska have increased risk or probability?
Yeah, genetic makeup from that, what we're seeing genetically, there's just some sort of gene line that goes around that increases their risk. If we go back to that slide, the Ashkenazi Jew, there is something that goes way, way, way back in that lineage and that germline that is just turned something on. If we look at cancer, cancer is just your immune system and this naughty cancer cell that's got like a mask over it goes, I'm just going to walk right past your immune system. You're not going to see me. So something in that genetic makeup just does not recognize that cancer cell, and it is off to the races. It can just remove it. It's just. No, it's extremely interesting. I did not go into a school to be a genetic counselor because it went way over my head, but I love that. It is so interesting when you look at the germ lines and where did they come from and the lineages that we all have in our background. Great question. Any other questions?
Why would a doctor do the stool test? You were so later into that's my first question, that they stopped doing the stool test. Second question is, if it's a recommended screening, say you need to do it every 5 years and we thought it was 10, but the latest that we had stood there.
Okay, so the first question was, why would you have that stool test and then a colonoscopy year later?
Yeah.
If there's a concern, if that first fit test came back negative, you could decide if you wanted to do the colonoscopy, or your provider could say it's a great idea to go in and just get a picture of what's going on. That way you have a baseline picture of what your GI tract looks like. It's always easier for those providers to say, oof, that looks a little different. Kind of like in the mammogram world, you get a mammogram every single year. Ooh, something looks a little different. Let's screen you again in 6 months. That's really the reason for going in and getting a colonoscopy. Your second part of the question was, if you miss your screening, that's okay. If you go, oh, I'm supposed to go in at 5 years and closer to 10 years, is that kind of where you're going with that? Or is it just, if you remember, go get it in? Is really what matters most. If you're feeling good, you're not having any real big side effects, okay, I waited 10 years. I got it done. Most important thing is get your screening done. And yeah, 10 years is a long time. I would forget. And our primary care doctors aren't always keeping an eye on that. They have hundreds of patients in their practice. So it's really on us to say, okay, maybe I need to set a calendar invite for myself in a few years to remind myself. If I don't put something in my calendar, I won't. I can still. And cell phones are great. They're going to remind you no matter what platform you're on. Great question. Of course, any other questions?
I found it interesting that on your symptoms, it says it can be constipation or diarrhea or this and all that. So there's really no demarcation to tell you if you're having diarrhea over this period of time or constipation, or can you have multiple symptoms?
You can have multiple, because you can have constipation and diarrhea. We don't know. So is that constipation being caused by an outside thing in your world? Is it that I got dehydrated? I had the flu. I didn't eat anything for 3 days. I got dehydrated. Okay, now I'm a little constipated, but I also took medication on top of it, right? But wait a second, now I have diarrhea. Okay, this is totally, my gut's all screwed off. Should I call my doctor? Well, we know we had a flu. So let's wait a few weeks. Let's see if our gut gets back on track. 2 weeks later, we're 10, 14 days in, and you go, this ain't right. Nothing's working. Tell your doctor. We really save that. I love that you called that out, though. You know your GI system is completely different from what it was, and it is not changing, and there's no outside factor to say, that could have changed it. Like if you have surgery, you don't eat, you get anti-nausea medication, that just causes all sorts of backup. If you take pain medication, that can cause constipation too. So really look at those factors in your life that could be causing it. And if you can't tick and tie it to something going on in your life, call your doctor and say, I have those concerns. Let's check it out.
Thank you.
Any other question? I talk fast, I move fast. Well, thank you all so much. No, go
I
ahead.
did have another one.
Yeah.
So after the treatment, if you have a colostomy and all of that, what is the prognosis for like stage 1, stage 2, stage 3, stage 4?
It all depends on where you're at. So
Okay.
stage 1, 2, normal life. You're,
Okay.
simple treatment, surgery, maybe a little radiation. You're not going to shorten life. When we get to stage 3, stage 4, it really depends on where you're at. How big was that tumor? What kind of treatments did you have? I treated many patients and they're still alive 20 years later. My grandmother lived, she had a stage 3. She lived 25 years past her colon diagnosis. And that was in the 90s. She didn't die from her colon cancer. She had heart failure. I'm completely unrelated to her cancer diagnosis. So she did all the treatments to really get all the treatments you can to shrink that. And most people are living well beyond their cancer diagnosis. So it really depends on how the severity of it is. But great question. Any other questions? I appreciate your guys' questions so much. You guys are awesome. Thank you.